I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. How are you coping with the stresses of the pandemic? The unpredictability of this virus has been challenging. This is the People's Pharmacy with Terry and Joe Graydon.
The pandemic experience has brought the best and the worst out in people. Some people, especially healthcare workers, have been selfless in their efforts to help others. Now the strain is becoming overwhelming.
Many of us are feeling cooped up and deprived of hugs. Zoom meetings are not a satisfying substitute for real social contact.
Those who have lost friends and family members have had an especially hard time grieving the death in isolation.
Coming up on the People's Pharmacy, get help on how to deal with stress, anxiety, depression, and uncertainty.
In the People's Pharmacy Health Headlines, did you have trouble finding a rapid COVID test over the winter holiday? Lots of people did. Now a government-sponsored website, covidtests.gov, has started providing free tests. Each household can order up to 4 rapid tests for home use. People who live in zip codes that have been hit especially hard by COVID-19 infections will be given priority. The administration plans to provide 1 billion home tests through the program. Those without internet access will be able to order their tests over the phone. People who need tests will have to plan ahead, though. The program expects to ship orders between 1 and 2 weeks after receiving them. In addition, the post office may take several days to deliver them.
Besides free home COVID tests, Americans will now be able to access free N95 masks. Adults will be able to request 3 of these high-quality masks at pharmacies and community health centers across the country. N95 masks are far more efficient at blocking aerosol-borne viral particles than other face coverings. Most important, they fit snugly around the face to block virus from leaving or entering the breathing area.
Israeli researchers report another possible benefit from COVID-19 vaccination. 2 doses dramatically reduce the risk of developing symptoms of long COVID. The observational study included more than 3,000 volunteers. One group tested negative for COVID. Another group tested positive, although they had been vaccinated with 2 Pfizer-BioNTech shots. The third group was unvaccinated and tested positive for the coronavirus. All these individuals are part of a long-term study. People who were vaccinated were about 60% less likely to experience symptoms such as fatigue, headache, weakness, or muscle pain compared to people who were infected but unvaccinated. In fact, people who had received both shots were no more likely to experience lingering symptoms than those who were never infected with COVID-19. Long COVID, also known as post-COVID syndrome, can be debilitating. Even people who are asymptomatic sometimes develop long-lasting symptoms, including shortness of breath, brain fog, joint pain, chest pain, palpitations, or insomnia. This research has not yet been peer-reviewed and will need to be replicated before we can be sure that COVID vaccinations actually reduce the risk of long hauler syndrome.
The most exciting new treatment for COVID-19 is Pfizer's oral medicine Paxlovid. In the clinical trial that led to the FDA's emergency use authorization, the antiviral drug was nearly 90% effective at preventing hospitalization. People need to start taking it within 3 days of their first symptoms. It's expected that the drug will become much more widely available in coming weeks. There is one caveat, however. One of the ingredients in the 2-drug formulation interacts with many other medications. People taking drugs to control cardiac arrhythmias, high blood pressure, elevated cholesterol, and HIV infections may have serious complications as a result. Anyone prescribed Paxlovid should ask both the physician and pharmacist to review all other drugs they take to prevent dangerous interactions.
Do you ever fall asleep with the radio or television on? What about dropping off while you listen to a podcast with your earbuds in place? New research suggests that this might interfere with a normal night's sleep. You may think your brain is offline, but it appears to be paying attention to certain sounds even during sleep. The researchers recruited 17 young adults without sleep disorders. They monitored the subjects for brain activity using electroencephalograph recording. During sleep, the volunteers were exposed to either familiar or unfamiliar voices. The unfamiliar voices triggered brainwaves indicating arousal. This suggests that some part of the brain stays alert for possible danger even during sleep. An unfamiliar voice could signal a stranger and thus disrupt sleep and relaxation. Perhaps we'd sleep better if we turned off all our devices before bedtime. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. We're excited to see the COVID curve starting to flatten after having spiked skyward. In a few places, cases are beginning to come down, but many states are still experiencing record numbers, and hospitals are filled to capacity in lots of places. Healthcare workers are under enormous stress. So are families that have had to deal with severe illness. Even those who have not been touched directly by COVID-19 are feeling the strain of a pandemic that does not seem to be ending anytime soon. How can we manage the stress and anxiety this crisis has created?
To get some practical advice, we turn to Dr. Jeffrey Rediger. He is medical director of the McLean Southeast Adult Psychiatric Programs and an assistant professor of psychiatry at Harvard Medical School. He has a Master of Divinity degree from Princeton Theological Seminary and publishes in the fields of medicine, psychiatry, and spirituality. Dr. Rediger is the author of Cured: Strengthen Your Immune System and Heal Your Life.
Welcome back to the People's Pharmacy, Dr. Jeff Rediger.
Thank you for having me.
Dr. Rediger, there is an expression that people like to use. May you live in interesting times. They attribute it to a Chinese curse. That's baloney. Apparently there is no such curse. But there is a book that was written in China, some kind of publication back in 1627, titled Stories to Awaken the World. And there is a phrase, better to be a dog in times of tranquility than a human in times of chaos. Well, Dr. Rediger, we are living in times of chaos. What is the impact of COVID on our mental health?
It's huge. As a psychiatrist who supervises several emergency rooms, the psychiatric aspects of those emergency rooms, it's shocking what's been going on. There's a quiet psychiatric pandemic that's been going on now and building in intensity over the past year and a half or 2 years. I feel so much compassion for everybody, but especially for our college students, our adolescents, for parents who have to navigate impossible demands between managing work and children at home. There's so many impossible, unique scenarios that people are managing every day, and you just have to have compassion for what people are dealing with.
What are you seeing in the emergency departments these days?
We are seeing unprecedented levels of depression, anxiety, substance abuse, suicidality. I think people are living with uncertainty. They are afraid. They are tired. They feel like the pandemic has been unending. We have had unprecedented levels of patients waiting for psychiatric beds in several of our emergency rooms. Sometimes we have had 60% of the people in the emergency rooms are waiting for psychiatric beds that don't exist. We've never had a demand like this. One of the emergency rooms recently had 108 people waiting for psychiatric evaluations, and that has been a waxing and waning amount in terms of how many people are in the emergency room every day, but it's been unprecedented.
Well, it's not as if there weren't problems beforehand. I mean, we've heard of patients with psychiatric problems waiting in the hallways, not for hours, but literally for days. And that was before COVID. And now I'm guessing they may be waiting in the hallways for many days.
Yes, and it's tragic. We have our emergency rooms often these days are lined with cots on every hallway with people waiting for evaluations, waiting for psychiatric beds. And we have, for example, at McLean Hospital here in Boston, we have opened another hospital. We have 64 new beds trying to take off the weight from our emergency room burdens. And that's just a drop in the bucket, frankly.
Well, what about healthcare workers? I understand how desperate patients are, families, but healthcare workers have been under the gun now for almost 2 years. It's got to be taking a terrible toll.
It is. They're afraid as well. And I think what a lot of us do is we just try to support each other. We try to pay a lot of attention to our own well-being, to the things that are genuinely restorative to each of us. Many workers are afraid. Some are leaving to do outpatient work or for different careers altogether because the burnout is a significant issue right now.
What is behind that burnout?
I think there's a lot of things. I think we all hoped and expected that the pandemic would probably be over by now, and now we're going into our third year, and there's still a lot of uncertainty about when this will end. I think the different mutations of the virus have played an issue because it just makes it feel like this is unrelenting. I think watching people become ill and sometimes die from COVID has been an unrelenting issue. And so that's caused a lot of just fatigue for our healthcare workers, for doctors and nurses and technicians. Sometimes watching someone die because they didn't get vaccinated has been an issue, and feeling like this is preventable, and watching children who are left behind or loved ones who can't visit in the hospital, they take a toll after a while.
I'd like to ask you about children. And when I say children, I mean, really, we've got this wide range of ages and circumstances. So we could start with little ones who aren't yet old enough to be vaccinated, and they may be in preschool or daycare. And then we go all the way up through into young adults who are in or just out of college. Can we look at some of the challenges for these younger age groups?
Yes. I think one of the really significant tragedies here is that so many children and young people are missing developmental milestones. And so they are re-entering classrooms in person maybe a year or a year and a half later, but they've missed critical milestones and need to catch up in some way. And so that creates more anxiety and stress for the children. It creates anxiety and stress for the teachers and for the parents. And you just have to have respect and compassion for what everyone is managing here. College students is something that I have a special heart for because we see so many college students at McLean. And it's just a reality that college is about so much more than just taking classes. When you're sitting at home and you're becoming an adult, but you're sitting in your parents' home and you're not able to interact with friends in college, but you're sitting in front of a computer screen, that's very stressful and takes a significant toll on these young people. I saw a study the other day, 41% of college students have experienced severe anxiety in the last year or two. 34% have experienced significant depression. Over 14% have seriously contemplated suicide. These rates are all significantly higher.
Stop right there. What were those numbers again about suicide?
Over 14% of college students during the 2020 and 2021 school year seriously have contemplated suicide.
Wow, that is so scary.
It is scary.
What can you and your colleagues do? Because, I mean, I think we all expected this would be long over by now. And
yes.
Here we are in the middle of, another variant, and there's talk about, well, there could be yet another one after this one, and people are going, wait, when is this going to end? I don't think I can take it much longer. That must be especially true for children and teenagers.
Absolutely. And they don't even have the wiring in their brains to live with the kind of patience that is more of a possibility for parents and for those of us who have had enough decades in our lives to fully wire our brains, for example. And so it's more difficult for children and adolescents and college students.
What can parents and caring adults do for these young people who are in such distress?
I think there's a few things. I think we have to all step back and try to have compassion for ourselves and for what these younger students are living with. We can't give to another what we haven't first given to ourselves. And so we need to have compassion and practical strategies to create well-being for ourselves so that we can then figure out strategies that provide well-being for college students, for our loved ones who are younger, children and adolescents, etc. And try to live as non-judgmentally as we can, try to look for ways to do restorative activities together. So many children and adolescents and college students are starved for connection right now. They feel lonely, they feel isolated, and need ways to just connect with people who have skin on in ways that are restorative and loving.
I wonder how parents can even start a conversation with let's say, a 4 or a 5-year-old, because they don't have any experience interacting with a child who has gone through this last 2 years. There's like, where do you even begin?
Yeah, that's a great question. And I think looking for ways, touch, hugs, play, those kinds of things are really important. Finding activities where you all can laugh together, where we all can laugh together. I think these kinds of things can be restorative. Finding ways to emphasize a normal life, finding ways to bring as much normal interaction and fun into life as possible. Adequate rest, nutrition, those kinds of things can go a long ways.
You're listening to Dr. Jeffrey Rediger. He's medical director for the McLean Southeast Adult Psychiatric Programs and an assistant professor of psychiatry at Harvard Medical School. Dr. Rediger is the author of Cured: Strengthen Your Immune System and Heal Your Life.
After the break, we'll find out how to recognize that someone is under more stress than they can manage.
What questions should we ask to learn whether a friend or family member is suffering with depression?
Older people may be feeling especially isolated during the pandemic. What can be done to alleviate that?
We'll also discuss some coping strategies we can all use. Medical professionals might need them more than most right now.
How can people with positions of authority and responsibility take care of themselves?
It's more important than ever to practice self-compassion.
How can we foster resilience in ourselves and those around us?
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products developed in Germany and made in the USA. KAYABiotics.com.
Also by CocoVia, offering its cardio health product with 500 milligrams of cocoflavanols in powder and capsule form. More information at cocovia.com.
How do you know when you're under more stress than you can handle? What are the symptoms? Even if it's not their fault, some people feel guilty or ashamed if they come down with COVID. If they give it to a friend or family member, they often feel even worse.
To help us manage these uncomfortable emotions, we're talking with Dr. Jeffrey Rediger. He's medical director for the McLean Southeast Adult Psychiatric Programs and an assistant professor of psychiatry at Harvard Medical School. Dr. Rediger is the author of Cured: Strengthen Your Immune System and heal your life.
Dr. Ettinger, I wonder if we could review some of the symptoms that would flag that a person is having a specific mental difficulty. For example, anxiety. For example, depression. What symptoms should people be looking for?
Good question. That can come out in a variety of ways. There's been a lot of experience for many of us, I think, with seeing behavior that feels more uncivil in our society. And I think we need to understand that some of this uncivil behavior reflects anxiety, fears about the unknown and uncertainty that we all are dealing with. And sometimes when people are rude in a checkout line or in brief encounters during the day, we need to remember that we're all under stress and we're all in this together, and that sometimes these behaviors reflect anxiety and depression and fears about the unknown, and perhaps even levels of hopelessness that can then become despair and even a secret suicidality. That's something we often see in the emergency room, is that people will be living with suicidal feelings that have been present for months, and it's hard for them to know what to do because they can't find a therapist or a psychiatrist who even has room in their practice to take them. And so many people are living without the resources that they need to get better right now.
So let's be very specific and drill down on depression. How would we begin to know if a friend or family member was in fact beginning to be severely depressed? What kinds of questions should we be asking? What kinds of symptoms would they display?
If a person begins to become more withdrawn, if their appetite changes, either becoming less or eating more than usual, if their sleep pattern becomes disrupted, if they begin to talk more negatively about themselves or others, if they are uncharacteristically irritable, if they begin to miss deadlines with their responsibilities. It's my experience that, especially in the last couple of years, it's not that people are lazy, for example, but that they are burdened and often carrying silent burdens that they are having difficulty finding words for.
A lot of those symptoms are going to result from the pandemic. I mean, we are isolated. We are having trouble sleeping. We are worried. And so separating, quote unquote, normal pandemic behavior from real depression may be challenging. What about anxiety? Because I think a lot of us are really anxious if we have to gather in a group.
Yes.
Even if we have masks on, we're probably going to be quite anxious.
Yes. And the distinction that psychiatrists typically make between anxiety and depression that is manageable in the community and within one's family versus clinical anxiety and depression is the effect that the anxiety or depression have on one's ability to work or love. And so if work begins to become too challenging, or one's performance is changing, or if one's ability to navigate the complexities of relationships with their loved ones, friends or family, those are signs that the normal stress-related response to the environmental stresses has gone beyond to a clinical point and needs attention.
Dr. Ettinger, a few minutes ago, we talked about children and the stresses that they've been facing, and I'd like to ask you now about older people, and specifically people who may live in a facility where visitors have been severely restricted, if not altogether forbidden, for 2 years now. What are the special features that this presents for older people's mental health, and what can be done about it?
Yes, this is another area of real tragedy, and I could tell you just stories that are sad with the isolation that has been imposed by the pandemic, where loved ones in nursing homes or assisted living facilities can't visit with their loved ones. Sometimes if they have memory issues, they don't understand why they can't. Other times they don't understand why they can't walk the halls, for example, and that's a critical issue if their health requires that they are physically active and yet they need to be confined to their room. And so sometimes people become depressed and frustrated and irritable and more difficult to work with within the context of the needs of the unit. And sometimes they stop eating even because they don't understand why family can't visit, or they're frustrated that they haven't seen their loved ones in so long. And so finding ways to maintain contact as much as possible through iPads or FaceTime, through Zoom, these kinds of things can maintain as much contact and normalcy as possible.
Dr. Rediger, I'm wondering about coping strategies. A lot of us are anxious.
Yeah.
When will this end? How do we cope? What do we do if we're starting to feel anxious, stressed out, fearful? And it's not just non-healthcare workers. I mean, physicians, I suspect at some point are also experiencing anxiety. And so I'd like to know about their coping strategies, and nurses and respiratory therapists and first responders. How can we all cope with our anxiety, our depression, our fears, our stresses?
I've been doing some workshops for preventing burnout and creating self-care for our medical staff. And it's critical because so many of our staff are burnt out, and finding ways to do restorative activities, whether that's taking walks in nature or going fly fishing or spending time playing games with children or watching a TV show after work. Everybody needs to think, what are the activities that are restorative for them, and pay real attention to that, because I have seen that too many people are busy taking care of many others, but they aren't paying attention to their own well-being. And it's so important to understand we cannot do for others what we have not first done for ourselves, and to make sure that you build time into that. It's not selfish to do that. It's critical to take time for your own well-being.
It's kind of like what they say on the airplane, put your own mask on first.
Yes, that's a critical perspective. And honestly, there's so many factors that prevent us from understanding the importance of that simple insight. I think we also need to have compassion for ourselves and for others. Everyone's frustrated, everyone's tired and fatigued, and we just want to make sure that we're telling the truest stories about ourselves and each other, remembering that every person brings something beautiful and good into the world that we do as well, and to make sure that that's the lens through which we are seeing ourselves and others, that we see each other with eyes of hope and love and compassion in a time when uncertainty and fear is very prominent.
I'm wondering what recommendations you might have for people in, quote, authority, end quote. In other words, the flight attendant who is trying to get people situated on an airplane and wearing their masks and putting on their seatbelts and then getting grief. And we've unfortunately seen a lot of examples where they've really been abused. But also government workers or healthcare workers or town council members who are being berated by the public. How do they begin to take care of themselves, protect themselves from such abuse without lashing out?
Yeah. Well, I read a study that's perhaps relevant here. In 2019, there was a study done and it found that 93% of people polled said that uncivil behavior is increased in the United States. And 68% of people said that this is a major problem. This was before COVID. This was before January 6th. And we all know that this is a problem that's even more significant now. I think we need to be able to see the deeper story. We need to realize we're all in this together. We need to realize that our capacity to see behind the frustrations that people have and remember that this is a human being. We have to set boundaries perhaps around antagonistic or uncivil behavior, because everyone needs to be treated with respect. We want other people to be treated with respect, and we want ourselves to be treated with respect. And we can do that by remembering that every person, including ourselves, brings something important in the world, that everyone needs to be treated with respect and dignity, and that we can get through this together, and that we are all in this together.
Dr. Ettinger, I have heard of people who feel extremely guilty, or perhaps they feel shame when they realize that they have contracted COVID-19. How can they practice self-compassion so that they don't suffer with those feelings of guilt?
Yes, I think we need to just have so much compassion and actively let go of judgment about things. Illnesses are contracted for so many reasons, and it's not just a simple thing about whether a person was vaccinated or not. For example, there's genetic susceptibilities, there's environmental susceptibilities, there's a lot of toxins in our foods and in our environments. There's autoimmune conditions that a person has little influence over in the immediate moment. There's so many factors that interact and interact with our stress levels and whether we are in fight or flight at the time to create situations that are unique to each person and just cannot be judged.
I know people who have contracted COVID even after being vaccinated and boosted, and they tear themselves apart. Like, where did I catch it? How did that happen? I was being so careful. But then perhaps even worse is they may give it to somebody else, a family member or a friend, before they even knew that they were contagious. And so now it's not only the guilt that, how did I catch it? But then, oh my goodness, how could I have given it to Aunt Martha at Christmas? And so how do you help people overcome that sense of, oh, it's my fault, I feel so bad, I'm a bad person, when it was way out of their control?
Yes, and there are no bad people here. This COVID pandemic at so many levels creates humility for all of us, whether we are scientists or doctors or people doing our jobs, trying to take care of our loved ones. It has broken down every category you can imagine. We would like to think we have all these great answers. We would like to think our science is perfect around this and that we have solutions. And we do have solutions that help, but they're not perfect. And so we have to just be able to live with compassion and self-compassion for things that simply are beyond our control and try to find a way to be with each other in this and not isolate and impose silent judgment on ourselves for yet another reason.
How can we foster resilience in ourselves and in those around us?
I think the paradigm shift that needs to occur here is that we need to find ways to feel comfortable investing in our own well-being and in getting rid of the inner critic that is so pervasive and exacerbated in a time like this when a lot of uncertainty and self-questioning is going on. We have to understand that we can't just take care of others. We can't just take care of our loved ones. We can't just keep going and going and going without also taking care of our own deeper needs, whether that's our physical needs, our emotional needs, our spiritual needs. We need physical nutrition, we need emotional nutrition, we need spiritual nutrition, and we need to find a way to be together in this.
Let's talk about some of the resources that are available. Online therapy is now a thing. I even see commercials for it on television. And there's, not just psychotherapy, there's CBT, cognitive behavioral therapy. I'm just curious about your perspective on online therapy, Zoom therapy, if you like.
Yes, McLean Hospital, for example, here in Boston has switched over to a lot of virtual programs, both in group programming with our partial hospital programs and also in individual outpatient treatment. And And the research that's compiling around that is showing that it's very effective and sometimes more effective for people who are having difficulty leaving their homes, for example, and normally would be difficult to reach. And so this shift to a more virtual treatment is certainly complicated. It's very effective. There are people who prefer in-person treatment and need that and need to find a way to do that when possible. But it's also true that the research is really robust around the effectiveness of virtual treatment. And that's been a shift that is proving to be helpful to many people that otherwise we would not have been able to reach.
Dr. Rediger, we only have about a minute before the break, but I'm wondering about medications. I suspect that anti-anxiety medications are up, sleeping pill prescriptions are up, antidepressants are up. What about the pros and cons versus the online therapy?
Medications certainly play a role. They can definitely make therapy more effective. If a person has been struggling with anxiety and depression for a long time, sometimes the right medication can just make the journey forward less uphill. And there's definitely a place for that. It's my view that medicines treat symptoms by and large and not causes. And so if a person doesn't want to be dependent on medications for years or constantly in search of medications, it's important to address the deeper causes of what's ailing a person. I think depression and anxiety are gifts, frankly. I think they are a sign that something is out of whack in a person's life, and it's important to not just treat symptoms, but to ask, what is my body telling me? What is the message about my life that needs to be addressed? And then to genuinely address those issues, because that will heal things in a way that will provide a level of well-being that a person didn't have before the symptoms started.
You're listening to Dr. Jeffrey Rediger. He's medical director for the McLean Southeast Adult Psychiatric Programs and an assistant professor of psychiatry at Harvard Medical School. Dr. Rediger is the author of Cured: Strengthen Your Immune System and Heal Your Life.
After the break, we'll get some advice on coping when we encounter someone who is not behaving well.
It's so hard to grieve a loss when you can't gather in person. What alternatives exist?
We'll get practical suggestions on managing stress, anxiety, guilt, and depression.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by CocoVia, maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
And by Kyabiotics, microencapsulated, organic, hypoallergenic probiotic products developed in Germany and made in the U.S. KAYA-biotics.com.
What do you do when you're faced with someone who's angry, confrontational, or behaving badly? Flight attendants, nurses, bank tellers, and grocery clerks have all faced challenging situations when someone refuses to follow the rules that are meant to help reduce the spread of the virus. But even in normal times, we've all had to deal with frustrations. How can we cope?
Our guest, Dr. Jeffrey Rediger, is a medical director for the McLean Southeast Adult Psychiatric Programs and an assistant professor of psychiatry at Harvard Medical School. Dr. Rediger is the author of Cured: Strengthen Your Immune System and Heal Your Life.
Dr. Rediger, I'm wondering if you have advice for us as to exactly how we can cope when we encounter someone who is not behaving well. They may be rude, they may be angry. We have spoken about the fact that, there are reasons why people are feeling irritated, why people may not be at their best behavior. How can we respond?
I think it's important to not take things personally. And I don't want to say that blithely or superficially. I think there's times when it is personal. And if a person is angry that another person is wearing a mask, or a person is upset that a person is gay and open about that, there's so many beautiful things that are shifting in our society right now. And that creates a lot of feelings and challenges a lot of beliefs that are deeply held for all of us. And so how to be in this in a way that takes very seriously the need for everybody to feel respected and valued, and to have boundaries around what is uncivil or unsafe behavior, and still not take things personally when possible, and to remember this is a human being who is frustrated, and maybe they have they're having a bad day, and they're feeling stress about something completely unrelated to the current situation, and to just try to have grace-filled eyes when we see the behavior of someone else, so that we can give them the benefit of the doubt when we can. That's one way that can help, I believe.
I'm going to ask you for some advice pre-COVID. So for a moment, let's imagine 5 years ago, you're in a supermarket. You see a mother getting very frustrated with her toddler, who's perhaps not behaving particularly well, but the mother's getting really, really angry and shouting and, pulling the child by the arm and just behaving really badly. I know a lot of us feel uncomfortable intervening, but how do we do that in a way that would perhaps defuse what could be a volatile situation pre-COVID? Now add COVID to the mix, and of course it's even worse. So how do we intervene, whether it's at a family gathering or whether it's in the scenario that I'm describing in the supermarket?
Well, I think we need to understand that the mother who's mistreating her child was probably mistreated herself, and doesn't know what it means to manage a challenging situation with a child when she was gone through her own trauma, whether developmental or worse growing up. And so how to intervene in a way that is compassionate but clear, and to communicate directly or indirectly that you just want to see the child treated with love and respect, but also the mother to be treated with respect. And that's the only way to do this in a way that will result in a good outcome for both. Because if you are punitive towards the mother, she will, based upon past experiences, take that as another way to even react against the child more harshly when no one is around. And so it needs to be done in a way that is compassionate for both, but clear, and understands that this didn't come out of the blue, but comes out of one's own trauma and lack of emotional nutrition.
It's a pretty tall order. I do want to switch gears just a bit. We talked before about medication, and now I want to ask you about meditation. So is there a role for meditation, for example, mindfulness meditation, or something of that nature to help us with our stress and our fear, our depression, and our anxiety?
Absolutely. And there's many different kinds of meditation. I think some people will sit down for 10 minutes or 20 minutes a day and just seek to let go of the feelings inside of themselves and empty the mind, open their heart, and begin to relax. Others are going to find a more active approach to be helpful, and that still can be meditative, whether it's taking a walk in nature, or going fishing, or playing a game with your children. That can also be a way of just quieting the mind, relaxing the body, opening the heart. There's different activities that one can bring into this. And so I don't want to say that meditation is a monolithic thing where you sit down and are cross-legged and quiet for 30 minutes a day. That's not necessarily what meditation has to be. It's about becoming more aware of what's going on in your body, letting go of feelings, emptying the mind so that you can open your heart and begin to relax. And that can be done through a variety of means and methods, depending what works for you.
There are now a number of biofeedback techniques, equipment and such that are available that are actually quite affordable. In fact, on my watch, I have an app that allows me to do breathing, and it's both visual as well as it'll vibrate for me as I'm supposed to breathe in. And I find that whenever I have a few moments, if I just hit that 5-minute breathing exercise, it makes a difference. But there's a variety of biofeedback options that are available to people if they can't find their own way to meditate or do some kind of quiet relaxation practice.
Yeah, I think that's a really important point. What we're talking about at one level is how to get out of chronic fight or flight and into a more relaxed parasympathetic state that activates the vagus nerve and allows us to have a completely different neurochemistry. We know on the basis of clinical and laboratory research that many of us live in chronic fight or flight. And that means that the beautiful, brilliant cells of your immune system and your body are being bathed in the stress hormones too much of the time, whether that's adrenaline or cortisol or norepinephrine. And so if you can find an app or find an approach that helps you relax so that you can activate a parasympathetic neurochemistry, that's a completely different neurochemical milieu. And neurochemical nutrition means that you are relaxed, that your immune system, that your cells in your body are being bathed by dopamine, the pleasure molecule, or oxytocin, the love molecule, serotonin, the antidepressant molecule. These create a really different neurochemistry that not only supercharges your immune system, but helps you experience pleasure and happiness and connection with yourself and others. And it's a very different pathway in terms of what becomes possible for you both immunologically and relationally.
What I find is that my watch not only provides me this breathing app, but it also monitors my heart rate. And so after 5 minutes of deep breathing, it's not unusual for my heart rate to slow down 5 or 10 beats per minute. And so I can actually kind of get my own feedback that, hey, that's working. So for folks who actually need some kind of a cue to get a sense of what's going on internally, that can be kind of helpful.
It sure is. And that shows that you are in touch with your body and activating your parasympathetic nervous system. And you have a tangible indicator that you are moving out of fight or flight and activating these other neural hormones of dopamine and oxytocin and that sort of thing. It's a really good indicator of your ability to do that.
Dr. Rediger, I'd like to ask you about grief. We saw a statistic not too long ago suggesting that almost a third of Americans said that they knew someone who had died as a result of COVID, a family member, a friend, a family friend. And yet we are having a lot of difficulty gathering for the usual commemorations of death. For example, my father died a year ago, and we have not yet had his memorial because gathering people from all around the country didn't seem like a safe thing to do yet. How can people manage their grief in this situation?
I'm so sorry about your father. That's such a difficult thing to have happen in any time. And during COVID, it's exponentially more difficult. And that's difficult. My father had a stroke last week, and he's also struggling. And we are trying to sort out many of those same issues right now. We are keeping him isolated. We have him on hospice at home. The funeral will be very different than we would have done pre-COVID because COVID continues, and many of the people, loved ones who would want to attend, will need to attend virtually in some form because many of the friends of my parents, unfortunately, are older and are at high risk of catching COVID themselves if too many of us are together. And so we are actively looking for ways to do things virtually or by phone call, or find other ways in which we can safely be together to share in what we all are grieving at this time.
And I can say that it is possible, because we did attend a memorial service several weeks ago that was incredibly thoughtful. Terry, perhaps you can describe Ricardo's memorial service.
It was entirely virtual, which was wonderful because the participants were international. It was planned as a bilingual event, and the planners had translators on board for it, so that those who were most comfortable in Spanish could listen to everything being translated into Spanish, and vice versa. Those who were more comfortable in English would hear what the Spanish speaker said translated into English. So this was a very beautifully done memorial for a really wonderful person, a friend of ours. We have, however, seen that if it's simply tacked on, people who are not familiar with Zoom may have a difficult time appreciating the memorial service. We had a completely different experience in which the Zoom portion of the service was disrupted by people who didn't know they should have been muted. So I'm really sorry to hear about your dad, and hope that you all will be able to find the right approach supporting him until it's time to let him go.
You raised some really beautiful points about the possibilities of Zoom allowing people to be involved who live at a distance and wouldn't be able to travel safely at this time. That does provide opportunities that, even though there's losses associated with all of this, there's also things that can happen that otherwise could not have happened.
Dr. Rediger, we have just about 2 minutes left, and I wonder if you could sum up some practical steps that our listeners can implement when dealing with fill-in-the-blank stress, anxiety, depression, guilt, insomnia, fear, social isolation, loneliness, and then perhaps the biggest of all, uncertainty.
Well, it's so frequent that the people I work with are burnt out, they are run ragged, they are fatigued, and that's often why they are seeking help. And that's often what has allowed their depression and anxiety and even suicidality or substance abuse to run rampant in their lives. And so I tell people it might seem selfish to take care of yourself, but it's not. You've got to do the things that are truly restorative for you. They may not be restorative for another person, but if they are for you, they're worth paying attention to. Make sure you're getting physical nutrition, and look at nutrition not as the foods you're giving up, but for the nutrition you are giving yourself, because that makes the psychological aspect of this easier. Make sure you are getting emotional nutrition, so that you're getting out of fight or flight and getting the experience of the dopamine release, the oxytocin, the love molecule, the serotonin, the antidepressant molecule. Make sure you're getting that kind of neurochemistry built into your life with emotional nutrition. And then figure out what is the spiritual nutrition that helps you feel valued, that helps you feel seen, that helps you see your value in the world and helps other people see and experience their value. And have compassion for yourself, for others, so that we can overlook the irritations, the frustrations that we all are having right now, and be together in this rather than more separate and more isolated.
Dr. Jeff Rediger, thank you so much for talking with us on the People's Pharmacy today.
Thank you for having me.
You've been listening to Dr. Jeffrey Rediger. He's medical director for the McLean Southeast Adult Psychiatric Programs and an assistant professor of psychiatry at Harvard Medical School. He has a Master of Divinity degree from Princeton Theological Seminary, and publishes in the fields of medicine, psychiatry, and spirituality. Dr. Rediger is the author of Cured, Strengthen Your Immune System and Heal Your Life.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products developed in Germany and made in the U.S. KAYABiotics.com.
Also by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome, now with an annual health club plan. Online at verisana.com/health-club.
And by CocoVia, the maker of high-potency cocoflavanol supplements that support cognitive and cardiovascular health. More information at cocovia.com.
Today's show is number 1287. You can find it online at peoplespharmacy.com. You could subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning.
If you'd like to add a comment about this show, look for the post on our website. How have you dealt with people who are angry? What do you do to manage your own stress and anxiety? You can enter your comment at the bottom of the show notes for number 1287 under the podcast tab.
At peoplespharmacy.com, you could sign up for our free online newsletter and get the latest news about COVID-19 and other important health stories. By subscribing to our newsletter, you'll have regular access to our weekly podcast, and you can find out ahead of time which topics we'll be covering.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.